Happy March is sweet.
Sweet.
Happy March.
With 2 drops of the oral polio vaccine, this child is partially protected against poliovirus type 2. This team of vaccinators from the Thompson Bay Community Health Center off Wilkinson Road is one of over 4,000, comprising 14,000 volunteers who moved from house to house to immunize children against a debilitating disease called polio, also known as poliomyelitis.
The well body people and they go around now for get the polio vaccine. So the picking then this opportunity for the picking there, they pay nothing are free. Polio na sick way no good, they cause Diane and die foot for picking.
This exercise, which ran from May 10th to 13th, was the first round in a synchronized campaign in 6 West African countries, including Sierra Leone's Mano Union neighbors, Guinea, Liberia, and Cote d'Ivoire. The World Health Organization, or WHO, says these are among 12 countries in the West and Central Africa region that have been experiencing sporadic outbreaks of poliovirus in the last few years.
So these 6 countries, they are West African countries, neighboring countries, they are going to respond at the same time to this outbreak to ensure that all children in these countries are reached at the same time. So in case of cross-border movement, moving from one country to the other, such children will not be missed. That's the basic idea behind this. And also, of course, it also, when we work together, we go further, isn't it? Yeah, but if you want to go faster, you walk alone. So here we are working together.
Polio affects the nervous system and can lead to paralysis and, in extreme cases, death. Children under 5 are the most affected. 9 million children from 0 to 59 months are being targeted in these 6 countries that also include Burkina Faso and Mali. The second round is scheduled for June 7 to 10th. In Sierra Leone, 1.5 million children are targeted with a dose each of the type 2 poliovirus oral vaccine during each round. Experts say this is the category of people most susceptible to polio. Deputy Minister of Health 1, Dr. Charles Senesi, presided over the official launch of the campaign at the Rush Road Community Health Center in the east end of Freetown.
Indeed, today is another historic day for we all Nassau, especially for the kingdom. At the Ministry of Health, we laid a lot of priority on the well-body business of everybody in this country.
Few miles away from this location is the Marbella community, where a strain of the poliovirus type 2 was last detected in the country in March this year, prompting these rounds of supplementary vaccination. According to WHO, of the 3 strains of wild poliovirus types 1, 2, and 3, types 2 and 3 have been eradicated worldwide. As of 2022, endemic wild poliovirus type 1 remains in circulation only in Pakistan and Afghanistan. But on May 14, 2024, WHO declared an end to the latest outbreak of the wild poliovirus type 1 in 2 southern African countries, Malawi and Mozambique. That strain of virus is, however, linked to Pakistan. Dr. Jamal Ahmed, Polio Eradication Program Coordinator for WHO's Africa region, told ManoReporters that this hasn't in any way changed Africa's status as wild poliovirus free.
Our objective is to completely and 100% eradicate polio globally. And to achieve that, we go through different stages.
Elsewhere, it's the vaccine-derived strains, also known as circulating vaccine-derived polioviruses, that have been keeping the global health community busy. Data show that 23 countries in the WHO Africa region recorded cases of the circulating vaccine-derived polioviruses between 2020 and 2021. Sierra Leone recorded a total of 34 confirmed cases within this period. But unlike its neighbors, Sierra Leone has not recorded any human case of the virus since 2020. This latest detection of the virus strain in the Marbella sewage system came shortly after the detection of the less dangerous type 3 vaccine-derived poliovirus in a child in Gambia, as explained by officials at this press conference on the eve of the launch of round 1 of this campaign.
We know polio we are responding to. We are not alone. It is not Sierra Leone alone that is involved in this. In West Africa alone, we have 6 countries. Sierra Leone, Liberia, Guinea, and Ivory Coast. These are very immediate neighbors. And of course, Burkina is far up there, but Burkina is connected to Ivory Coast. and we have Mali there. So it's like, you know, this is West Africa issue. And mind you, in Sierra Leone here, the sample we got was from environmental sample. It is not a case that we have. It is an environmental sample that we got positive case from. But what that means is that there is someone there in the community still shielding the virus. We have been certified polio-free, yes, but the borders are open. Movement of people, particularly from Guinea axis and Liberia. People are coming in and out on daily basis unchecked. We don't even know their vaccination status, and they are coming for either to see families, or you're coming for trade, or coming for weekly Luma, particularly like in Gambia, in Bamo and Luma, people are there all the time. So we are getting these cases. That's why it is to me, I'm not surprised when the sample here is linked to that of Guinea. I'm not surprised because of the traffic that we have between Sierra Leone and Guinea. For us to for us to conduct a very effective campaign, it has to be synchronized. That is the good thing, and this is what I'll be pushing for. I hope we take the same stand we are taking for polio, for measles and rubella, because it's the same thing that is happening. If we go silo, Sierra Leone go and organize their own campaigns different from Guinea, and Guinea do their own different, Liberia also, we will never get it right.
The UN Children's Agency, UNICEF, is providing the vaccines through the support of the Global Vaccine Alliance, Gavi.
We want to emphasize on this collaborative effort, and we know that collaborative effort pay. I think Harold has been reminding us that those collaborative efforts of the ministry in Sierra Leone, Ministry of Health, of partners, led to the eradication of white poliovirus in Sierra Leone, but also in Africa. And you know, it has been like 14 years since the last white poliovirus case in Sierra Leone. So that's actually a milestone. But what we know is still we are below optimal level of vaccination, and we need to sustain our efforts. And the recent detection of the polio variants in the environment, in the sample, serve us as a critical reminder that we must still come together and intensify effort. And we can only prevent polio when we reach herd immunity through comprehensive vaccination.
Health authorities say the target is to cover at least 95% of eligible children, irrespective of their vaccination status.
Targeting under 5 children, we wanted more than 7,000 doses. But what we have now is what we are going to prioritize the main areas of the country where we think we can target. Of course, we are going to cover the entire country, but we start where we actually discover this particular virus in the serious sample.
A major fear, however, is the effect of mis- and disinformation on public acceptance of the vaccine, which was seen in display during round 1 of the campaign.
In terms of the preparation, I not see them pass the message well. Yes, I believe let them make an more videos, let people get the message. Because some will go, they say, hey, they don't start for this year, so I don't even know. So we go find for let them help we and they get do them and do more news around. Okay. So we know we'll get some difficult, so we'll work at places. Even we go on one side, one flat woman refuse, say picking the taker. Yes, he say because you know those kind of medicine, the gun, this, that, so he refuse me.
The Ministry of Health is banking on the media's support as well as traditional and faith leaders to help in awareness raising and mobilization efforts. Here at the Emergency Operations Center at Cockrell, this group of journalists and social media bloggers were capacitated as part of a nationwide training for social mobilizers and monitors. Sheikh Ibrahim Sise, Imam of Masjid At-Tayyiba, known as Kuranko Mosque, located in Pipeline off Wilkinson Road, is among faith leaders trained for this campaign. Imam Sise is a member of the Qumra Network, an award-winning grassroots community engagement organization affiliated with the NGO Focus 1000. He dedicated the second half of his Juma sermon on day 1 of the campaign to the importance of vaccination, referencing the Quran and Hadith.
I still talk about waiting, vaccination or maclate. We get root inside Islam, only point to that, yes. The Prophet sallallahu alaihi wasallam, Hadith reported different Sahaba that reported, inside Muslim and inside Bukhari. When the Prophet said, "Man akala sab'a ajwa,"
At the end of the prayer, this congregation member approached the imam for some clarification on the vaccination process.
Yes, alhamdulillah, we get the opportunity for to talk about this market or this vaccination we go on today about the polio. Because in the Quran, Surah 5, Ayah 32, Allah say, if anybody contribute for save one life, you will be rewarded as if you don't save the entire humanity. And for contribute for save life, we get different way for contribute for save life. We know to medical people who go prescribe injection or tablet or drip. However, attitude of people practice of people belief of people we still can contribute for change that mindset, they for let them accept the correct practice will go help for save the Pekin and life. We include for let them able accept for take the Pekin them for give them the market.